So, hi everyone. I think we'll get underway. I've asked Joseph nicely to sort out any residual issues we've got with room allocations. Now, Joanne Harding, who's one of the panelists, I can definitely see. Liz, if you're in the room, could you put your camera on? I think I saw you earlier on. And also Anthony Hunt, who should be joining us, the leader of Torvine Council.
Hi Nathan, yes, I'm here.
Yeah, there you are.
Somewhere.
All right, so thanks everyone. Again, thanks for taking part in this conference today and being part of this great experiment with Progress 100% online. So this is the first breakout session, which is looking at health and social care and the effects of the COVID-19 pandemic on our communities, on ourselves, but also, I want to, if we can, have some sort of reflection about what it will mean for us and politics and how we look at health and social care in the future. I don't know about you. I mean, speaking personally, I've got some underlying health conditions and decided that I would rather spend the lockdown with my parents back in Wales than in central London. So apart from devolving into a 15-year-old again, it's been some time since I've been that young, but I think I've made the right decision. But it's interesting how this, more than any other crisis that I can remember in politics, has had an effect on me in thinking about how fragile life is and what our place in the communities might look like. So I think it's a very important issue we have a conversation with. So I'm going to stop and just ask our panelists to introduce ourselves. So we've got three panelists. We've got Liz Kendall, we've got Joanne Harding and Anthony Hunt. And then maybe if the three of you introduce yourselves in that order, and then back over to Liz to kick off today's session. Thanks.
Hi. Should I start, Nathan? Hi, everybody. It's Liz Kendall, Shadow Minister for Social Care, MP for Leicester West. And it looks like we've got 135 people in this session. So that is really wonderful. I'm very grateful to Progress for organising this.
Or maybe, if we're having an issue with Liz's microphone.
Oh.
Can everyone hear Liz? Or was it just me that can't?
Others can hear me, can't you?
That was my fault, everyone. I had my volume turned off. I'm going to.
Oh, I see.
Right, fine.
Anyway, I hope it's nice to see all your lovely smiling faces, and I hope you're all well. And it's, you know, I think the number of people that have signed up for this conference and for this session shows just how important it is to many of us. I'm obviously going to focus sort of particularly on the social care aspect. There are others who may well talk about the NHS as well. But I think that this virus, this awful virus, has really quite brutally exposed the long-term fundamental problems that we have in social care and its relationship with the NHS. And I think of those as three key problems. One is that social care has for too long been seen as a second-class citizen compared to the NHS, when the truth is, and this virus has shown beyond any doubt, that the two are absolutely equally important. If you look at what's happened to the NHS actually, throughout this crisis, I mean, there was an absolute priority to reform the NHS so it could cope with the virus. You know, and it's been very successful. The NHS hasn't been overwhelmed. We expanded intensive care capacity. The Nightingale hospitals were built to make sure, you know, we had extra capacity if hospitals were overwhelmed. We did get the ventilators in place, but that similar focus, attention, grip, and reform on social care didn't happen. And just on a very, very basic level, we've had many care home and home care providers talk about terrible problems with getting protective equipment for staff, where essentially all of their normal supplies were just basically requisitioned for the NHS. Now, I am not saying that it wasn't absolutely essential, for the NHS to reform itself, to get the PPE for its staff, but treating social care and care workers as less important, I think, has had terrible, terrible effects. So that's the first thing. The second problem that this virus has exposed and exploited is that you cannot treat the two systems as separate. You know, they are inextricably linked. Now, I have always thought, you know, there's one person with one set of needs. They don't see a separate social care need or a separate health need, neither do families. But this virus has made that, you know, clear at a tragic level, because without doubt, people were discharged from hospital without tests, not because the NHS wanted to seed infections into care homes, but because the priority was seen as being clearing the hospital beds. But what ended up happening was that virus was spread into care homes, and the two systems are linked. They should be one system. And the failure to treat them as joined, I think, has led to those terrible consequences. And the third thing that the virus has exposed, I think, is how these absolutely vital services have been underfunded for too long, and that care workers have been undervalued and underpaid. And quite frankly, when we go and clap outside every Thursday night, those clapping has got to turn into action. And if it means anything, it has got to be that we get a pay rise for care staff. You know, the average salary of care workers is £16,000 to £18,000. This is for doing some of the most important work in this country, which is looking after the people we love most, our elderly and disabled parents and relatives. And the long-term underfunding and undervaluing and underpaying of care staff, we already had huge problems with vacancy rates of 122,000 vacancies even before we went into this crisis. And it's because of those vacancy rates that many care providers have ended up relying on agency staff, and it has been often the agency staff moving between care homes that has again been one of the causes of the spreading of this virus. So those three, I think, fundamental problems have been exposed by this. But I should say there have also been some really amazing positive things. The stories of care workers going, you know, above and beyond has, to me, been one of the most inspiring things. You know, care workers willingly moving into care homes so that they don't spread the virus because they care about the people they are looking after. Care workers doing even more for the people home care workers doing even more for the people that they're looking after, getting them food, doing their washing for them, because they love their jobs. And the passion that you see is incredible. I would also say that certainly in my constituency, we've seen this sort of emergence of the mutual aid groups, volunteers coming together to try and get help and support to elderly and disabled people. And, you know, now, if you need some shopping, you can get it in the afternoon. You would never, ever be able to organise that via the local authority. It's been something extremely positive, and I hope with the right support and resources, we can keep some of those important voluntary and community groups, because I think if you think about yourselves here, first of all, the one thing I'm desperate for now, I'm sure you all are too, I want to see my family. That's all I care about now, is I want to go and see my mum and my dad, and I want a hug. That's the thing I want most of all. So how important your families are, and how important it is with your friends and neighbours. I certainly have you know, become much closer to friends and neighbours during this, and I think that's something that we need to keep from this crisis too. So the second thing that I want to say is, I think there is a massive opportunity now to get a fundamentally new settlement for social care. Just as after, I mean, the war analogies are all getting on everybody's nerves, let's be honest, but unfortunately I'm going to make one myself. After the Second World War, Labour helped, put in place the NHS. It was it was a fundamentally different system that we had after the war, because we wanted to change society for the better, and we decided that by pooling our resources and sharing our risks, an NHS system free at the point of use was a great legacy for generations to come. And I think it falls upon our generation, post this awful virus, to create a new settlement for social care. And quite frankly, I think if we can't achieve that now, after everything that's happened, we might as well pack up and go home, because this is our chance. And I believe there is an appetite for change. But what I would say is, just echo some of the points that Rachel made. It won't just fall into our lap. I think there is a bit of a sense, oh, this crisis has proved X, Y, and Z, and therefore it must change. Well, actually, if there's one thing I've learned throughout my time in politics, is you have to make the argument. It will not fall into your lap. So, and I think there's actually, in a way, a risk that some of the misconceptions about social care will be entrenched as a result of this crisis. Don't get me wrong, sorting out what's happening in care homes and improving support for elderly people is obviously absolutely essential, but social care is also for people with disabilities. A third of the care users and a half of council care budgets is for working age adults with disabilities. And we've heard precious little about that. Equally, understandably, the focus has been on care homes, but the majority of people get care in their own homes. So, some of the entrenched misconceptions about social care, I think we will have to battle against. But let me say something about how I think we need to move forward on this. It's really important that we as progressives start with what is our vision for the kind of care services elderly and disabled people and their families want to live the life they choose. Because I think too often at the moment, the services that we have is paying people to go in and do tasks, which are important, but it's not what people really, if you ask people what they want and need, they want services and support earlier on, so that they keep fit and healthy and living independently for as long as possible. They probably want, as much as possible, support from family and friends, but we ignore unpaid family carers who provide the vast bulk of care and actually might do a huge amount, but they desperately need help and support. And they also want links with the community to live as full and fulfilling lives as possible. And ideally, people want to stay in their own homes for as long as possible, rather than end up in a care home. We will always need care homes, but I think one of the big challenges emerging from this crisis is what should be provided between care at home and care homes. Because even fewer people will now want to end up in a care home because of what's happened. And other countries have a lot more different kinds of housing support, whether that is people moving into new housing, which is open to the rest of the community too, but where they can gradually scale up their care
of their mental health, and it's a particular concern for those young people who we know are more exposed to abusive or violent households as well, and that's coming all the while
sell their homes to pay for care, which is a very important issue, and we need to do that. But it's not the only issue. And if you're a working age adult with disabilities, the issue is not about selling your home to pay for your care. So we have to start with our vision of care services and then say, how can we pay for that? And I think it's absolutely essential now that we have a system which pools our resources and shares our risks, rather than leaving individuals to face sometimes catastrophic care costs. And if they're unlucky enough to have dementia, rather than say, or than cancer, you pay for your dementia care, but you don't pay for your cancer care. And I think that feels so unfair to many people. I could go on and on about this, and I'm happy to take questions about any of these issues, but I believe that this is our generation's opportunity and responsibility
through social media, where they get to peer into other people's lives and see how people inadvertently reveal that they're not having the same kind of lockdown. High profile cases of hypocrisy, obviously particularly great. They know that their families and loved ones are at greater risk, and they also know that their services are more likely to be hit with cuts either in the present or potentially in the future. And what I particularly worry about, given the last few years that we've had politically, is we know that there are a lot of populists who want to be quite parasitic on that pain, and are looking to exploit it. And that therefore poses a big challenge for those of us who want to create some positive change out of this awful period. And I think one of the main things for me is that this period has exposed the lack of voice.
Has just said then, I do absolutely believe this is a golden opportunity for us to shape social care for the future. As somebody that's worked across health and social care for the past 22 years and seen the changes and cuts to services, now we really have to sort of grasp the nettle and think about, as Liz described, really what is our vision. In local government, I think we've been looking at a really old-fashioned model of care for too long. So everything has predominantly focused on hospitals and the acute sector. So we think about the NHS and we think about social care as two very, very different systems. And as Liz said, they are inextricably linked, and we have to start thinking about that. So it was interesting, I was on the Health and Wellbeing Board call yesterday, and one of our Tory councillors, after the presentation was given about all the work that had happened over the course of this COVID pandemic, he actually said, I didn't realise the magnitude of work that goes into social care. I was absolutely astounded. 10 years of austerity and conservative cuts, and he had no idea what the impact of those were on the residents we represent in Trafford. So I think that, as Liz said, really, we need to no longer kick into the long grass the very difficult conversation about how we fund social care. It will be a difficult conversation, but we absolutely need to have that, because for too long we have seen poor quality care, and we have seen care workers not paid adequately and not valued adequately. So I think that's one of the first things we need to do, is to have a conversation about care. In local government, the majority of our spend is on social care. And I think we tend to think of social care is very much seen as the poor relation, but I've seen some fantastic examples of how we really pulled together throughout this crisis. And I tend to think that when we're sat at home on Christmas Day eating our dinner or on holiday, a lot of our carers are just keeping the show on the road. They're out there dealing with people in the community, supporting them and keeping them well. I also think we need to change the rhetoric on care homes. When we talk about care homes, it's as if it's something over there and bricks and mortar, when actually care homes are where people live. They are a community in our community. And too many times I see where we have kids going in at Christmas and sing carols. And I tend to say to a lot of our counsellors, a care home is for life, not just for Christmas. And we have to start thinking about the people who live in those communities and making sure that they feel valued and are treated with respect and dignity. And that starts with building a workforce that is valued and respected. So here in Greater Manchester, we have taken responsibility for our £6 billion health and social care budget, and that has allowed us some opportunities to have some autonomy over those decisions. So we've started with the Health and Social Care Academy, and we are looking at going out to speak to schools and colleges and allowing them to believe that a career in social care is something to feel that they will be valued, supported and encouraged to progress throughout social care, too often we have NHS staff classed as heroes and angels, and that's right. What we've done around the health service, protecting it to deal with this pandemic, has been the right thing to do to build up that capacity. However, here in Trafford, we are anticipating a huge spike in demand for social care in June and July as people come out of hospital and need some of that intensive therapy in the community. We can't do that without an adequately trained and supported workforce. We have gone some way in Trafford with the Unison Ethical Care Charter, which, working with our trade unions to ensure that staff have adequate training, that they're not having to buy their own uniforms, that they're being paid travel time between journeys from one house to another, that they're also, one of the very basic things, and I often cite an example of my own family. When my gran had care, I saw different staff coming to look after her, delivering the most, the really intimate personal care from complete strangers. She never had an opportunity to build up trust with anybody because of the turnover of staff, different people coming in day in and day out. That has to change. We have to build up a workforce that feel that they can stay in that job because they are paid well, their terms and conditions are protected, and they are allowed to thrive in that role. So I think this is a golden opportunity to think about how we pay for it, how we develop a workforce. But I would like to make a plea to Liz, really, in that councillors are an absolute asset to helping you develop that vision for social care. Local councillors are rooted in their communities. They do know what is needed, what their population looks like, what their demographic needs are. So a plea really that, to make sure, and I know that you will, and I am very reassured with Cllr's leadership that he has really started to engage with councillors and bring councillors on board as to how we develop our policies. So what I don't want to see happen when we talk about integration of health and social care, that doesn't necessarily mean that we have to nationalise social care, because not everybody who has a social care need has a health need. So I do think we need to be careful in thinking that we don't need to throw the baby out with the bathwater. We've done some great work in local government. Here in Trafford, we've had the development of the community hubs. And as a councillor, I think one thing that it's been a frustration is the bureaucracy that we've faced. We have arbitrary figures set around delayed transfers of care. Having to get people out of hospital back into the community has been incredibly difficult, and councils have been penalised because they haven't done that quickly enough. And that may be because the social care package isn't there, or a care home hasn't been right for an individual. But in the space of a week, our delayed transfers in Trafford are at 2 a day. So all those barriers and all that bureaucracy has been broken down. The subject of this session has been, we can't go back. We cannot go back to having people sat in hospitals not being able to have access to the care that they need. And that means adequate community care, adequate and safe care in care homes. And as Liz said, which I do want to reiterate, I constantly bang the drum with my colleagues in local government, social care is not just about older people's care. My portfolio area covers substance misuse, drugs and alcohol, mental health, learning disability. We have to make sure that social care is seen as something that you may need at a time in your life. You might not need it all of the time, but it should be about empowering you to live your best life and empowering you to retain and regain your independence. So I'm happy to take questions too, but can I just also make a plea to Liz that whenever we put something out from Labour, can we not use old hands? I think it's the worst thing that anybody does around social care, puts pictures of old hands. But you're absolutely right, we have a great opportunity to do something good, to set Labour's vision for social care and I would really encourage you to make sure that councils are part of that vision. Thanks.
Great stuff. Cheers, Joanne. Then lastly, in our opening comments, we've got Anthony Hunt. Anthony is the leader of Torfaen County Borough Council in South Wales. I think, Anthony, you took over in 2017. So, Anthony, over to you to tell us about what's happening in South Wales and how potentially issues are diverging in Wales compared to the UK government.
Thank you very much, Nathan, and apologies that I couldn't introduce myself before. The internet went down just at the wrong moment. I blame the local council, but never mind. I'm the leader of Torfaen Council in South Wales. As you can probably tell from my thick Welsh accent, I grew up in Stevenage, which was somewhere that had a Labour MP back in '97. Still, thankfully, has an excellent Labour council led by Sharon Taylor, but it's the kind of seat that we need to win back. So that's a little bit about me. I'll start with a raging cliche, I know, but we're talking here about the ultimate Cinderella service. Yet without it, my experience in Gwent over the last few weeks is that the NHS wouldn't have survived without social care in the best of times, let alone during a crisis like this. We peaked very early in Gwent in the coronavirus crisis, and we just about stayed within the capacity of the health service, and that was because of the efforts of social care. And you know, let's not beat around the bush. When we applaud our NHS workers, quite rightly, we should also be applauding those who work in the care sector, because they were a vital, essential part of us getting through this crisis. Yet the sector is, let's be frank, characterised by a number of, let's say, suboptimal things. First of all, fragmentation. We pay a lot of money as a public sector to a lot of different providers. Do we really get value for money at the moment? I'm not so sure. Secondly, it's characterised by low pay, by a low rights workforce who are very often undervalued. As a result, as Joe and Liz rightly said, we end up with carers with multiple jobs, trying to pay their own bills. We end up with very high turnover, as quite often carers leave because they can earn more working in a clothes shop. And really, we just do need to reflect what that says about us as a society, when you can earn more selling clothes than you can providing vital and quite intimate care to some of our most vulnerable people. So I really think, as both previous speakers says, we need to move beyond clapping for these people on a Thursday into really seeing how we can break the undesirable parts of the sector as it currently stands and build a new model as a result of this situation. I'm lucky to be a leader in Wales. Speaking to my English colleagues as council leaders quite regularly, I do see that. It's not because things are perfect here in Wales, but because we have had a joint approach during this crisis with the Welsh Government. It's an approach of co-production. It's an approach of regular dialogue with ministers. I'm on the phone to Mark Drakeford and ministers on an almost daily basis, talking about how we can get through things together as local government and Welsh Government working hand in hand. We're lucky in Wales that we have a leader who looks at evidence carefully. I think the experience internationally has shown that those leaders who have enough intelligence and emotional intelligence to look at these problems in the round, they've usually been women. So I speak here as the token man, not wishing to do myself down too much, but we have seen those leaders who've taken that emotionally intelligent approach have been the ones who've taken the best approach to this. On PPE, for example, in Wales, we recognise there is a problem. I'm not trying to claim the situation is perfect in Wales now in our care homes, but we've managed to improve it by working carefully together with the Welsh Government and with our different providers to try and make sure there's enough PPE both in the health service and in the wider care sector as well. We do, however, suffer from a number of the same issues that I've just talked about in terms of fragmentation and low pay. And there's a determination, I think, in Wales from local government and the Welsh Government not to go back after this to how it was before. I really do think there's a bit of a fork in the road coming here in the social care sector. Local government, of course, has none of the glamour of central government, but all of the responsibility. I do despair during this crisis and before at ministers in central government who seem to think that because they make an announcement, things happen as if by magic. Like I could make an announcement that the tree outside my house sprouts £20 notes. It doesn't just happen. These things happen because they're implemented by very often local government. Yet very often the only thing that central government like to devolve to councils is the blame when things go wrong. Local councils do get the blame for the care sector quite often when things don't work. But to be honest, local councillors have strained every sinew over the past decade to protect social care. There's a limit to how much we can do though, because that does come at the cost of all the other services that we run, like environmental health, like public protection, for example, which have also shown to be vital in the current situation. So the question really is how we remold social care without resorting to sort of lazy, old-fashioned sort of status presumptions. Because I think very much a new model is needed, not going back to an old model at any point in time. In Torvine, we've been looking over the past 3 years at how we in-house some of our key services, for example, enablement and dementia care within social care, and how we move beyond the old sort of focus on price to one about wider value for money. And I think we need a better understanding of that within commissioning in the care sector. And I think we need to empower our councillors to make those judgments. Very often when we try to bring those considerations into commissioning, we're told that the earth will fold in on its axis if we bring such things into the conversation, but they don't, because I believe that through that sort of in-housing, we've got better care, we've got a more holistic wraparound approach that's better for staff and for our local economy, and I think that's worth saying because I think one of the best possible injections to move our local economies out of this crisis is going to be to give money to those low-paid staff, to raise their terms and conditions, to raise their rates of pay, because they will then help empower our local economies going forward. So I think that's the smart thing to do as well as the right thing to do. So I very much agree with the last two speakers. We need to take this awful situation as an opportunity, as a fork in the road to build a better future for social care. There is going to be a new model for social care after this crisis. Either it's going to be one that we plan with a strategy to make the system better, or it'll be one that will happen to us as providers collapse, return contracts to us and leave us to pick up the pieces. So I think really we either act or we get events hoisted upon us. To sort of end on a note of optimism, I think Liz is entirely right to talk about the reinvigorated community spirit and how we can use it as a model to help with social care needs. I think we need to use the acceleration of the decision-making process that has come about as a result of necessity in this crisis to do things quicker and better as local government. Sometimes we have in the past been very slow, let's admit it, to do things. Sometimes we get tied up in bureaucracy, and yet there are things that local communities have been doing. I'm helping pick up and distribute prescriptions, for example, to people in need who are self-isolating. That if you'd have told us we were doing that 3 months ago, people within my council would have had kittens, but it's worked. And I just think sometimes we do need to let go of this idea that we are the be-all and end-all, and act more as empowerers of the wider community. Whilst of course in social care there are things that do need to be controlled as well. I'll just end with a plea and a welcome really. I really welcome the way that local government has been brought into the fold under Cllr's leadership. I think we need to move beyond consulting with local government as we talk about issues from social care to anything else into engaging with us as people who have been in power for the past decade and have been making some really difficult choices. And I think people who are trusted by our communities to make those choices. And I think that sort of co-production, that cooperative spirit as an opposition can help us build for government. And I long for the day when people like Liz are in power at a national level and can help us in local government work together to make people's lives better.
Great stuff. Fantastic, Anthony, and fantastic, Joanne and Liz as well. I think definitely as someone who's been around this track for longer than he would care to say, we've got to look at Cllr's leadership and the COVID crisis as a way of fundamentally changing the relationships between various bits of the party and national local government. But also, I'm fed up of people saying that they've got a new social care settlement ready to put into practice, and then nothing happening, because we've been doing this the past 15 years, and it's time we got to act together. So I've got a couple of people who I've singled out to ask questions. I think I can run this for about 20 minutes. So the first question we've got here is from Claire Wilson.
Hello, everybody. My question is that given that most of the costs in social care are due to the increase in demand from working age adults, and that most older people will not need to use a care home, what is the solution to the funding of social care, which obviously is much needed?
Okay, thanks, Claire. And I might take these in 2 rounds of 2, actually, so people can collect their thoughts. And the second question we've got is from John Muir.
Hi, good afternoon, everybody. Thanks, Progress, for hosting the conference today. Thanks to Liz and Joanne and Anthony, really interesting panel. My question is around the role of austerity, kind of austerity past, present and future, if you like. So, and it is, how do we ensure that we stay constructively non-partisan during the crisis, but successfully continue to expose the role that 10 years of austerities played in health and social care, when there's a lot of the public that don't want to hear about that right now. And at the same time, there's a huge risk that the government, when we're outside of the crisis, the government will simply impose greater austerity very quickly to deal with the incoming economic collapse, and probably dress it up as something else, because although Johnson has said he doesn't like the A word, in all probability, those around him will probably force him down that track, and they will simply call it something else. So we've exposed it to an extent so far, but it needs to continue to be done, because we're probably going to face a lot more of it.
Okay, cheers, John. So in a way then, guys, that's kind of like 2 sides of the same coin. I mean, how are we going to overcome the push from the Tories to actually ram austerity down our throats and make the situation worse, whilst at the same time coming forward with some really interesting ways to fund a sustainable service? On that one, Liz, why don't you kick off?
I mean, just 2 minor issues. I've been reading all the chat comments, by the way, everybody, and I've got lots more to say on other things about co-production, co-design, community assets, the workforce, families, and engaging local authorities. But let me start with those 2 questions. On funding, I think the principles that we need to apply to how are we going to fund our vision for future care services. One is that the principle that we pool our resources and share our risks to create a better service, set of services for all, is essential. I do not believe we can go down the insurance route. It won't work, and it's not the right approach for particularly more disadvantaged families and for those on middle income. So we have to fight that suggestion that this is what happened. I was very involved with the whole deal not negotiations when they first happened with Andrew Lansley. Remember him and his lovely Health and Care Act? And the Tories' idea was you'd have a cap on care costs, and then you take out insurance to pay for the rest of the care yourself. And lo and behold, surprise, but one of the points we made was that's not going to work, and lo and behold, it didn't work. So I think that is essential. But I also, and this is my view, Liz Kendall's view, not anybody else's, is that I don't believe you can ask the working age population alone to pay for the entire extra costs of social care, particularly when we'll see the results of if we're going to have, as we've already seen, big increase in unemployment, the young particularly hard hit. So I do think we have to look at the contribution wealthier older people could pay to. So I think that if the Conservatives come at this from we need to cap care costs as the sole objective, we are going to end up not only with the wrong kind of focus on services, which will be predominantly on elderly people, but you'll also end up with the wrong kind of funding model, because that is not our only objective. And John's point on John Muir, your question on austerity. I mean, I wouldn't underestimate the Tories in that I don't think they're going to dive in and talk about cuts. if we think that they will, and that will, everything will, then we can make the case that we've always made about the underfunding of services. I wouldn't presume that that's going to happen. And I think you're right, John. I mean, part of me all the time is wanting to scream out loud. You have cut £8 billion from social care. You have, made terrible cuts to local authority funding. You've promised that the NHS will get whatever resources it takes, but you haven't done that for social care. And you claim you've given all this extra money to councils, but my council, of the £11 million it's had to deal with coronavirus, that it's not just for social care, it's to feed people, it's to get the homeless off the streets. However, bottom line is the public don't see us as credible, and they particularly don't see us as credible with their money. They don't trust us with their money, with their taxes. And unless we can start building up that credibility, which is why when Cllr talks about being constructive opposition, it is not pulling our punches in terms of holding them to account, but it is providing credible solutions. And I think I've talked about a big fundamental new resettlement for social care, but when I'm talking with the public, I think we have to provide the credible answers. So on testing, for example, in care homes, actually, we've got to test 1.2 million frontline care workers. That sounds massive and too big, but how I describe it is more local testing centres, more mobile testing units, and more tests directly to carers' own homes. And I always say, and my counsellors are in touch with all my care homes every day, they would be better placed to run the testing system. I really do believe that, than compared to what's happening. So we have to build credibility with solutions that are important, rather than, I think, talking about big, bold paradigm shift, which the public thinks we just want to get tested.
Okay, great stuff, that is. Joanne, over to you.
I think the conversations about funding, obviously from a national point of view, as Liz said, they're going to be difficult conversations that we have to have and think about what the ideal is. From a local government point of view, remember that these cuts have fallen disproportionately on some of the most disadvantaged communities, really. So while Trafford is seen very much as a leafy suburb of Greater Manchester, and we do have some real areas of wealth, we have a lot of communities that are really deprived, with huge health inequalities. And a lot of that is glossed over because we look at Trafford as a whole. So I do think one of the things we have to shift our way of thinking is around public health and prevention. A lot of social care is around crisis management. We wait for the point that somebody is in absolute crisis and end up with an incredibly expensive care package because all that work beforehand hasn't happened, the investment hasn't been there to support communities to keep themselves well. So I think we're going to have to shift some of the discussions more around public health and prevention, about how we manage health inequalities and really target and focus some of our interventions on those communities that need us most. So for example, keeping people well, keeping people fit. As part of this whole coronavirus epidemic, one of the things that has kept me really well is exercise, because I, like many other people, have had good and extremely bad days as we adapt to a different reality. So I think we need to focus on keeping people physically well, that keeping people out of hospital, because that's a really expensive model of care. So looking at investing back into drug and alcohol services. I know many people will have self-medicated throughout this crisis because it's a way of coping and dealing with anxiety. How do we keep people emotionally well? So how do we look after mental health and well-being? So instead of always throwing money, and this government has been very good at giving local authorities bungs of extra money where they say, oh, we're going to give you this much towards your social care to support getting people out of hospitals. It's just throwing good money after bad. And it's, the old adage, it's the sticking plaster over a gaping wound. So I think we have to shift some of that dialogue about prevention and keeping people well. And as for austerity, one of the things, again, I will always say is that scrutiny is our friend, and we have to make sure that at a local government level we scrutinise. I know in Trafford we've already set up a scrutiny committee which is looking at the impact of this pandemic on local government. I'm sure there'll be lots of other local authorities that are doing this. It is really important that we scrutinise, but as Liz said, what we have to do is come back with those really credible solutions. How are we, as a Labour Party, going to make lives better for the people that need us?
Right, cheers, Joanne. Anthony.
I think we need to focus the conversation on the future, not on the past. I mean, austerity's been awful for those of us in power the last 10 years, but it is what it is. And I think the more we obsess with the past, the weaker our argument in many respects. I mean, I know it's a sort of a progressive cliche, but to look at what the Attlee government did and the post-war settlement, they didn't talk about the past. They talked about building a better future and having that honest dialogue with people about what kind of a society they want to live in. And I think that's key coming out of this crisis. I think we need to be honest with people, but I do think we need to, their minds are now focused on what's really important to them. And I think lots of people will have seen that when the shit hits the fan, what they care about is their families, their communities, and the future for themselves. I think into that we need to sort of have that dialogue and present a settlement moving out of this crisis that we can build something that is fit for a civilized society. I think Liz's point about credibility is so key, because at the moment it doesn't matter what we say if people aren't listening because they don't believe that we're credible. I think that's a long job that Liz and colleagues have ahead of them, because it's a lot harder to build a wall than it is to knock it down. So I think we need to be patient with them as they look to build that credibility, because we need people in the space before we deal with issues like this, huge issues like social care, of giving us the airspace to sort of frame that potential alternative vision.
Thanks for that, Anthony. And again, all comments, I couldn't agree more with that. We've got to be more forward focused. I think actually we can't disinter all the arguments of the past 10, 15 years, however irritating they've been. We've got to have that positive vision for what we can actually achieve for our people and our communities. Right, we've got 9 minutes. Right, so the challenge here is for questioners and answerers alike to be a bit pithy. I've taken 2 more questions. The first one from Anne Sassoon, and then to finish us off, as it were, we've got Liam Martin Lane.
Hello, everyone. I'm really enjoying this conference. It's giving me good heart, and as somebody in a certain demographic, I'm particularly heartened as well. I have a very specific, brief question. Do we need to think about new convalescent settings? So it's not a particular building or whatever, but could I just ask that? Do we need to think about when people are not ill, they should not be in hospital any longer, but how can we think about convalescence?
Right, and Liam.
Thanks, Nathan. Lynn Martinane here. First of all, apologise for the slightly Rishi Sunak appearance, but thank you to everybody involved in a fantastic conference so far. My question is related to the vision for creating a social care system that is focused on people, that's focused on users. How can the counsellors, what can they potentially do in terms of researching what people actually want from a new social care system? Because I think the one thing that we can do to regain touch and credibility is not to impose Westminster ideas on local communities, but actually really focus in on what people want. So how can we kind of gather that research, as it were?
Okay, great stuff. Back over to you, Liz.
Right, quickly, and thank you, Liam, because I can answer a couple of the other points on the group chat here. So on Anne's point about convalescence, I think of it in terms of what the link, you know, the jargon is intermediate care, but actually what it is I call it step up or step down. If you need a bit more help than you can have at home, but you don't need to go into hospital, or if you don't need to be in hospital, and quite frankly, you don't want anybody in hospital if you possibly can, but you're not quite ready to go home. That's step down care, where you can have a bit of physio, occupational therapy, get yourself back on your feet. And lots of local councils are doing great work around that. But actually what we want is joined up health and care services that are funded by the NHS to have that step up and step down care. Quite frankly, I think we need a rapid expansion of that now, because care homes are going to be in lockdown for a long, long while. I can't see care homes exiting from the lockdown for a very long time. So we need, as part of the package of support that we need to demand for social care over the next year, I mean, we need to make an immediate demand of the government about those services and support, as well as a longer term funding settlement. Now, on the how do we get what people want and need, the question that Liam answered, it enables me to say, because lots of people raise this on the chat, I have been for 2 decades a champion of co-production, co-design. People know best what services and support they need. They are the biggest champions of preventive services because they don't want to get more ill than they have to. They are the best way to get services to join up because people don't see their needs through separate silos. And actually, families and users are actually the best at trying to get value for money and efficiency because they hate to see waste. So there are many organisations that are working on that co-production, co-design, and local councils. I would say one thing for all of you, if you're really interested in this, I'm a big champion of Social Care Future, which is a sort of group of organisations putting across a different vision that is created by care users themselves, both working age adults with disabilities and older people. And the truth is, particularly with dementia, you cannot get the right services unless you involve families as well as the users, because if you have dementia, it's about your memory, and your family is your memory. Your family knows what services and support and things what you like and want and need. So you can't get good quality care without involving families. Let me just say quickly on the local council stuff, which Joanne raised and everybody else. Right from the start, we have been working with local councils. Steve Reed and I did a Zoom with council leaders, Nick Forbes, talking about the overall picture facing local government, but with a specific focus on social care. I've already had a big Zoom with some of the social care leads through the LGA Labour group. I haven't had a discussion yet with you, Joanne, but we can't do this unless we absolutely involve local councils, not just in consulting them, but in developing the policies. So that is my absolute assurance to you. And quite frankly, Steve Reed wouldn't let it be anything other than that, having been a council leader himself. So I really do think that is going to be in our DNA. Finally, families. Families provide most of the care in this country. We have to get unpaid family carers more support. And one of my immediate priorities is to try and get the government to do testing and PPE for families too, so they can visit people in the care homes. There's been no visits from families. And if I couldn't go in and hold my mum's hand and tell her I loved her and she was in a care home, it would be awful. So we've got an immediate ask to get right there too. Thanks so much.
Cheers, Liz. If I could ask Anthony briefly to do, you've got 1 minute, and then I'll ask Joanne to also 1 minute to finish up after him. Great stuff.
Oh, just checking I'm unmuted. Yeah, very quickly then, the vision focused on people, I think, is a key thing. We need to get better at doing things with people, not to them, especially vulnerable people. I think too often we tend to, in the past, we tend to sort of treat people as, subjects to be experimented on and not people to involve and engage with what they want for the future and how we can help them live their lives better, as opposed to, just doing things to people. I think the think global, act local thing is key. I'd like to thank Liz for her engagement, along with Steve, on that with local government. I do think, as Liam implies, we're the ones who know more about what people want and how we can interact and use that proximity to help design the system. In new convalescent settings, other models, both locally and internationally, that we can look at. We've got a new hospital that's shortly being opened in Gwent. Thankfully, thanks to the Welsh Government funding it. We need to think in a joined up way about where there's residential sites around that hospital, how we could provide some of those intermediate settings so that people can live in their own homes and have access to care better. And there's lots of examples of that happening across the country with different councils, but we need to think in that joined up way.
All right, Joanne.
Okay, very quickly. So in response to different settings, as the change in legislation has taken place with the Care Act as a result of COVID, we were already in Trafford doing the discharge to assess, which was making sure that people weren't in hospital, but we could place somebody in a place where we could do a more detailed assessment to see what worked best for them for the future. But we also need to look at things like an older people's housing strategy, extra care facilities, as Liz mentioned, different models of care from around the world, from different countries. How can we make more smaller, supported, more intimate settings as opposed to great big buildings? I think for the vision, councillors are rooted in communities. We listen to what people want. Regularly, as chair of scrutiny, I would do listening exercises with not only family members, people in receipt of care, but equally providers. Very often they can be painted as monsters throughout the social care crisis. We have some excellent family providers here in Trafford that want to work with us to find a solution to this. So, and absolutely right, Liz, really touched a nerve, very emotive what you just said then. Being able to touch people, hold their hands, that physical contact throughout this. We will see the impact of this for months to come, and we have to start preparing for that.
Okay, great stuff. Thanks, Joanne. Just to finish off quickly before we let everybody else back in, what we're going to do is we can save all the chat here in this session. I can actually, I'm going to send it on to Liz so everyone's got those questions in the comments correctly. Something else is actually a piece of work we're looking at with Progress the next couple of months, talking to some of the think tanks, is to set up a bit of a policy commission on what are the progressive policy responses post-COVID, post-Brexit and post-COVID. And obviously I think health and definitely social care is slap bang at the centre of that. So I think we'll definitely keep everyone up to date and definitely keep Liz and want Liz involved in these conversations as we go forward. And actually when we're back in real time and we can potentially have at least 5 of us in a room, I think the fact that there was a bun fight to get in this room today, whether we need to be thinking about doing like a whole day thing for Progress members and local government to come together and have a proper long-term fundamental discussion about this. So watch this space. So thanks everyone. I think we're going to get a deluge again now from the other breakouts. But before we do, back to your reactions buttons. And a big round of applause for Liz, Anthony, Joanne, and yourselves. Great stuff. Thank you.